If you struggle with depression and you've finally found a medication that works for you, it can be terrifying to consider stopping it when you become pregnant. Fortunately, there are a lot of antidepressants that can be continued during pregnancy. There are also alternative therapies available if that's what you're comfortable with. Today, we're going to go over all of the pregnancy-safe options for managing your depression. Welcome back to Every Mama's Midwife. My name's Jess. I'm a certified nurse midwife and infertility mom, and I'm currently 28 weeks pregnant with an IVF pregnancy. I've struggled with both anxiety and depression. However, since most of my depression stems from infertility and pregnancy loss, my depression virtually disappears once I'm pregnant, but I know that's not the case for a lot of my patients. If your specific concern is anxiety, I posted that video last week and I'll link it here in case you missed it. When I make videos about managing different health concerns, I usually like to start with the alternative, natural, crunchy remedies first before moving on to the prescription medications, and I will cover the alternative remedies in today's video, but I know for most pregnant women who are struggling with depression, the primary concern is, can I keep taking my medications? So today, that's where we're gonna start. As always, if you are interested in these options, please discuss them with your healthcare provider. Fortunately, the most commonly prescribed antidepressants are usually safe to continue in pregnancy. These are medications like Zoloft, Prozac, Wellbutrin, Lexapro, and Effexor. If you do a lot of Googling, you will see scary warnings about the potential for newborn withdrawal when these medications are used in pregnancy, but this is extremely rare, and most newborns born to mothers on antidepressants do just fine. Overwhelmingly, the research has shown that it's better for both mom and baby to have mom on a medication that makes her feel mentally stable. We do start to see more issues in mothers who are on multiple medications for depression. Even then, the most common issue I see is that babies don't cry really hard at birth, but they're still breathing and doing just fine. It can be really unsettling if your doctor or your midwife hands you your newly born baby and it's not crying really hard, but babies can be breathing well without crying vigorously. I do like to warn my patients on antidepressants that this can happen because once as a student midwife, I was helping a dad catch a baby and I felt the baby's shoulder kind of pop as it came under the pubic bone. And then when the dad handed the baby to the mom, it did not cry at all. I started rubbing the baby's foot really hard, trying to get a response. The nurse was kind of panicking and grabbed the oxygen monitor and put it on the baby's foot. And I had this moment of sheer panic of, oh my gosh, I broke this baby. Fortunately, the midwife who was precepting me chimed in after a minute or two and said, you know, since you're on 2 antidepressants, it's not unusual that the baby's not crying, but their color looks great, their muscle tone looks great, and they are breathing just fine. I'm so grateful that she took a moment to verbalize that to the parents because it allowed both the nurse and myself to breathe a sigh of relief. That being said, there is a risk of a baby needing help to breathe at birth if their mother is on multiple medications that can cause respiratory depression, and I most often see this in moms who are struggling with opioid withdrawal. So in addition to multiple antidepressants, they're also on methadone or a similar medication. Less commonly used antidepressants like tricyclic antidepressants such as amitriptyline or antipsychotics such as Abilify are usually not recommended in pregnancy. This is due to the potential concern for birth defects, developmental delays, and more serious withdrawal symptoms. What's challenging is usually if a patient is on one of these medications, it's because they've already tried the more commonly prescribed stuff and haven't had a good response. If you're on one of these medications, it's a good idea to talk with your OB provider about the risks versus benefits of continuing your medication during pregnancy. For example, I had a patient a couple of years ago who was on Abilify after trying several other antidepressants, and she was in tears at her first OB visit, and she told me, I'm absolutely terrified to stop this medication. I will want to hurt myself if I stop it. So we decided it just made more sense for her to stay on it and continue it during pregnancy. I would recommend specifically talking with your prenatal care provider and not your primary care provider about this, just because I find sometimes primary care will tell patients to stop all of their medications across the board once they're pregnant, and your OB provider may be more comfortable with managing mood disorders in pregnancy. Ketamine is another less commonly used drug for depression, but it had the biggest impact for me when I was really struggling after my first miscarriage. It can be given as an IV infusion, an intramuscular injection, or a nasal spray, and it has a reputation for being really effective at helping patients who are having suicidal thoughts. Most of the data we have on ketamine in pregnancy is not related to use for depression, but related to use for anesthesia for patients undergoing surgery. There are concerns that it can cause uterine contractions, and we know that it does cross the placenta and can cause poor muscle tone and poor respiratory effort in newborns, so it's not recommended for obstetric use by the manufacturer. That being said, the clinic that I went to, which gave ketamine through an IV infusion, did tell me that they were comfortable providing that service to pregnant women, especially if they were having suicidal thoughts. UpToDate does not recommend withholding ketamine treatment for depression solely based on pregnancy status. There are some studies underway investigating the use of ketamine for postpartum depression, which I think is really exciting. I think it's going to be a wonderful drug for that. If you are just not comfortable taking medications during pregnancy, there are alternatives you can consider, but none of them are probably going to be as effective as an antidepressant. There was a study published about 4 to 5 years ago. Unfortunately, I couldn't find it, but it was in the certificate maintenance articles that I have to read every year for my license. And it found that women who were pregnant and struggling with depression had an improvement in their symptoms if they were consistently taking fish oil, consistently taking vitamin D, and using a happy light. A happy light is just a bright light that you turn on for 30 to 60 minutes a day, and you set it somewhere where it's not in your direct line of vision, but it's in your peripheral vision. And it's usually recommended that you do this first thing in the morning. Since I live in the dark and rainy Pacific Northwest, I keep one on my desk at work, and I use it through the fall, winter, and spring. I just turn it on first thing when I get to the office in the morning, and I leave it on for about an hour since I'm in and out of my office seeing patients. I've had this one from Trust Wellness for about 5 years. It's got 4 different light settings. Unfortunately, it's not available on Amazon anymore, but you can find several comparable lights that are available in the $25 to $30 price range. Also, because of Pacific Northwest life, I recommend a daily vitamin D supplement to all of my patients who are pregnant of 2,000 international units, and I recommend 4,000 international units daily if they're breastfeeding. If you want to add a fish oil supplement to your daily regimen, but you're worried about fishy burps giving you nausea, then I highly recommend the Nordic Naturals brand because it's lemon flavored. I'll drop an affiliate link in the description. Of course, talk therapy is always an option, but it can be hard to get in with someone quickly if you're not already established with a therapist, and it can be hard to get insurance to cover those visits, which can become really spendy really fast if you're paying for them out of pocket. I hope you found this video helpful. If you did, please give it a thumbs up. I post new videos every week about infertility, pregnancy, and motherhood after 35. So make sure you subscribe and turn on the notification bell so you don't miss an upload. Thank you so much for watching.